Hello, my name is Dr. Arshad Siddiqui. I'm the Medical Director of Adult Outpatient Programs at Princeton House Behavioral Health. Today, I'm going to talk about suicide, the risk factors, and how you can help yourself or a loved one who may be thinking about hurting themselves. According to the Centers for Disease Control and Prevention, suicide rates have soared nationwide over the past 2 decades. In New Jersey, they climbed by close to 20% between 1999 and 2016. The recent high-profile celebrity suicides can often result in copycat behavior, and that could even lead to even higher numbers as the latest data is gathered. Rising suicide rates can be attributed to a number of factors, but most often, economic stress and financial struggles are the primary reason. Alcohol abuse can also be a major contributing factor. As society has changed, increased access to the means to commit suicide, such as the availability of opioids and firearms, has also led to more deaths. For adolescents, I believe that social media can amplify symptoms by making people feel more isolated and alone. Social media offers a false sense of interaction when in reality, someone may just be sitting in front of a screen and in many cases not truly communicating or connecting with another person for hours or maybe even days. Whatever the reasons, when people attempt suicide, it's because they feel hopeless. They feel that things won't get any better. If you have had suicidal thoughts, it is important to realize that you are not alone and to reach out for help as soon as you can. The most important thing is to try to seek help from a mental health professional. But if you have trouble finding someone, talk to anybody who is available, whether it's a friend or a family member or anybody who you feel comfortable with. If you are in crisis, call the National Suicide Prevention Line, ask someone to call 911 for you, or head directly to the closest emergency room. The number for the National Suicide Prevention Lifeline is 1-800-273-8255. If you're concerned that a loved one might be contemplating suicide, there are warning signs to look out for. Loss of interest in oneself or others, or favorite activities. Isolating behavior, expressions or feelings of helplessness and hopelessness, lack of energy. Sleep disturbances is a very common symptom to watch out for, as well as a change in appetite, whether increase or there's a decrease. Difficulty concentrating and remembering things, as well as unexplained physical problems such as frequent headaches or stomach aches, which you might see in younger patients who might not be able to express themselves very well. If you recognize any of these signs, encourage the person to reach out to a mental health professional who can guide them to the appropriate level of treatment. If they're not willing to seek help and you think they're in immediate risk of hurting themselves or others, call the National Suicide Prevention Lifeline, or if things are escalating, take them to a local emergency room for evaluation and treatment. Princeton House offers a variety of programs for those who are dealing with suicidal thoughts. Inpatient and outpatient programs that are designed to help men, women, children, and adolescents address mental health issues as well as substance abuse problems, or a combination of both. Specialized programs are also available to help first responders. Also, Princeton Medical Center in Plainsboro has a behavioral health emergency department staffed by Princeton House clinicians as well as psychiatrists that are specially equipped to help people who are in crisis. Most issues that trigger suicidal thoughts can be managed once the underlying conditions are addressed and the problems that may have brought the person to the point where suicide is being contemplated are put into perspective. Remember, if you or a loved one are at imminent risk for suicide, please call the National Suicide Prevention Lifeline at 1-800-273-8255. The Lifeline is open 24/7 and offers free confidential support for people in distress, provided by trained professional counselors from crisis centers across the country.